This video is about OET writing. Let's begin with a little story. Imagine you're working as a nurse in a busy medical ward in Toronto, Canada. The shift has been very long, and your patient, Daniel Thompson, a 67-year-old retired carpenter, has been admitted for the past week due to complications related to diabetes. The infection has improved, the treatment has worked, and the doctor has decided it is time for him to go home. But there is one important thing: his care is not finished. Someone must continue to monitor his recovery. A community nurse will now take responsibility for the patient. But the community nurse does not know the patient. They were not present during the hospital treatment. They were not there when the infection was diagnosed. They were not there when the wound dressing began. So, how will they know everything they need to know? The answer is simple. You will communicate it through a professional letter. That exact real world professional communication scenario is what the occupational English test writing is designed to evaluate. The OET writing task does not test whether you can write a beautiful essay. It is something much more important in healthcare: your ability to communicate patient information clearly, safely, and professionally. In the writing section of OET, you will complete one writing task. You will receive case notes about a patient, and your task is to write a professional healthcare letter based on those notes. And if you see the time structure, the test lasts for 45 minutes. It is divided into two stages. The first 5 minutes, your reading time. So during this time, you read carefully the case notes and you need to identify the important information, and then you decide which points are relevant. And next 40 minutes, that's your writing time. During this stage, you can organize the case notes and you need to write the professional letter. You have to check for your grammar and clarity. And obviously, the recommended length is 180 to 200 words. So, in most OET exams, the task is one of these five types. It could be a referral letter where you're sending a patient to another healthcare professional, or it could be a discharge letter in which you're explaining the patient's condition after hospital discharge, or it can be a transfer letter that means moving patient care to another facility or another clinic, or it could be an advice letter where you're providing guidance to a patient or to a caregiver, and an update letter, which means you're updating another healthcare provider about the progress. So the referral letter is the most common one. Okay. And let me tell you the structure of a high scoring OET letter. A strong letter normally follows four main sections. The first one, introduction. So here you need to explain the purpose of the letter immediately. So the reader should understand the reason within the first sentence. Okay, example, you can tell, I'm writing to refer Mr. Thompson for ongoing wound care. That's it. In the beginning of the sentence only, just explain the purpose of the letter. So the second one is the patient background. So here comes the relevant medical history. You should take what matters for the receiving professional, not everything in a random way. Okay. And section 3, current situation. So you have to explain the recent treatment, current symptoms, progress in hospital. Oh. And section 4, request or recommendation. In this section, you have to explain clearly what you want the reader to do. For example, to monitor the wound healing, or to continue physiotherapy, or to assess medication compliance. These are some of the examples I'm just giving you. So the fourth section, either you can request what needs to be done or you can recommend. Okay. The OET evaluates your letter using 6 criteria. This is very important. Okay, on these criteria only your scores will be marked or evaluated. The first one is the purpose. What is the reason for writing? Is the reason for writing clear immediately within the first sentence or in the first paragraph? Because that's how it should start. Examiner should understand the purpose within the first paragraph, okay? And the next comes the content, whether you have selected the correct case notes, relevant case notes. Not all the information given in the case notes are relevant, right? Based on the receiver's end, you need to understand and pick up the case notes which are very appropriate to the receiver's end, not everything. So, selecting the correct details is a key skill. Got it? And the third one is conciseness and clarity. So good letters are concise, they are clear, they are logically organized. So try to avoid unnecessary details in your letter because conciseness and clarity also plays a major role in scoring criteria. And the next one is the genre and style. So your writing must sound like professional healthcare communication. Your tone should be polite, objective, professional. Got it? And the next one is the organization and layout. So here comes the structure because that matters a lot, isn't it? Information should flow in a very logical way, very organized way. It should not be like random and bits and pieces scattered everywhere in your writing. Don't do that. And then the language. So when we talk about language, there comes the grammar, spelling, vocabulary, medical terminology, sentence structure, all these matters. Okay? Now, let me show you some of the case notes here. You're a staff nurse at Maple Grove. You are a staff nurse at Maple Grove Medical Center in Vancouver, Canada. Your patient, Mr. Andrew Mackenzie, is being discharged after treatment for a diabetic foot infection. You have to write a letter to Ms. Laura Bennett, community health nurse, requesting ongoing monitoring and wound care. So this is your task, and let me just show the case notes. If you want, you can pause it and go through the case notes. So these are the case notes, and now this is the writing. So here, if you see the writing, you can identify all the scoring criteria are properly displayed over here. Okay, if you want, I can also just tell why this one will score high because the purpose is very clear. The first sentence immediately states, I'm writing to refer Mr. Andrew Mackenzie so and so. So the reader instantly understands the reason, isn't it? Because examiners value this clarity. And the content, if you see, it is well selected. We have included only the relevant information. If you want, you can just go back to the case notes and find out, and again go back to the prompt. What is required, to whom we are writing, only those specific information details are covered. We have covered the diagnosis, covered the treatment, progress, discharge instructions, request, and irrelevant details are excluded. So this shows good professional judgment, right? And conciseness and clarity. So the letter is about 190 words, which is very ideal. Okay, the sentences are clear and the information flows very naturally. And if you see the organization, the letter has logical sections. First one is the introduction, and then we have given the patient history, and then comes the treatment, current status, request. So this makes the letter easy to read, isn't it? And if you see the genre and style, of course, the tone is very professional. If you can see here, I would appreciate your assistance. So these are some of the professional way of showing your politeness, right? So that is exactly how healthcare professionals communicate. And the language quality, the grammar is correct, vocabulary is medically appropriate. Examples like diabetic foot infection, wound debridement, and intravenous antibiotics. So these terminologies demonstrate professional competence, isn't it? And finally, students often think OET writing is about complex English, but in reality, examiners want clarity, safety, professional communication. So if your letter allows another healthcare professional to safely continue the patient care, then you're doing exactly what the OET test is designed to assess. Got it? So that's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye bye.